Alright, my name is Ryan Dickerson. I am a Brody student in the class of 2025, and this is our embryology video for limb development. As always, our mission statement for Scrubs is a student-driven initiative that's aiming to develop supplemental resources for current and future cohorts that will pass through Brody, and we participate in a variety of subcommittees working to create resources for students, by students, as individuals who have walked through the course. The hope is that this will become a staple of the Brent student body, kind of exemplifying our unique collaborative community that we have to offer here. As always, we have a disclaimer that these resources are made as supplements and are in no way replacing the instruction by your Brody faculty. Please use these as supplements, and we hope these aid you throughout your time in the course. With that, let's go ahead and dive into the material. So in order to understand the embryonic development of the upper and lower limb, it's helpful to understand the different compartments that we have in the adult. So in the upper limb, we're going to have two primary compartments. We're going to have an anterior compartment and a posterior compartment. The anterior compartment is going to be the location of most of our flexors for the upper limb, whereas the posterior compartment is going to consist of our extensors. So you may also see these referred to as the flexor and extensor compartments. Down in the antebrachium or in the forearm, we again have the flexor compartment and extensor compartment, and again, these structures you're going to derive developmentally to compose these compartments. We have something similar in the lower limb, where in the mid-thigh we have a flexor compartment anteriorly, and then posteriorly, we have an extensor compartment anteriorly and then a flexor compartment posteriorly. So these terms should be flipped. And then distally, we also have additional compartments. We have a anterior, lateral, and posterior compartment. But the idea is that these compartments are going to arise during development, and then eventually when you have the adult structures, these compartments are going to persist as the structures that we know within the adult limbs. So now getting into some of the embryology for development of the limbs. Now, we need to recall that we initially formed a trilamellar disc, and this trilamellar disc is composed of three different cell layers. So we have the primitive streak and primitive groove. We have invagination of tissues. This is known as the process of gastrulation, and that is going to form a cell layer known as endoderm, a cell layer in between the overlying ectoderm and endoderm known as the mesoderm. Specifically, this is going to be the intraembryonic mesoderm, and then we have the ectoderm superficial. Now, during this process, the mesoderm condensed and formed a notochord. And the notochord is really triggering the propagation of forming the neural tube and differentiating the mesoderm into different regions. So the notochord is that condensation of mesodermal tissue, and it's going to give rise or cause differentiation of the mesoderm into the paraxial mesoderm, the intermediate mesoderm, and the lateral plate mesoderm. Okay, so this is all mesodermal tissues, but you're going to see that it's really important that we understand the paraxial mesoderm and the lateral plate mesoderm for development of the limbs. So remember, this is all under influence of the notochord to form these different regions. So in the initial formation of the limbs, we're going to start with having the limb bud formation. This is going to happen in the region of both the upper and lower limbs. And what's important to note is that the apex, we have ectodermal tissue. And the ectodermal tissue that's right on top of the limb buds is called the apical ectodermal ridge, also known as the AER. Right? So these initial buds are formed due to mesodermal proliferation of the lateral plate mesoderm. So lateral plate mesoderm kind of invades, forms the growth, and the ridge that is formed there of ectodermal tissue is called the apical ectodermal ridge. Now, what's important to note is that the apical ectodermal ridge is necessary to send growth factors in order for the limbs to elongate. So the specific growth factor that you might want to keep up with is fibroblast growth factor 8, or FGF. Okay, and so this is fibroblast growth factor 8 is being released by the apical ectodermal ridge to trigger the mesodermal cells, specifically the lateral plate mesoderm, to elongate and form propagation of the limb buds. All right, so remember we're talking about lateral plate mesoderm here. So eventually, when you're first forming these limb buds, you're going to get these paddle-like outgrowths. Okay, and so there's no fingers. It just looks kind of like a flipper. So these flattened regions are going to be called the hand plate and the foot plate. Hand plate in the upper limb, foot plate in the lower limb, and this happens around the 5th week of development. This will be the eventual place where you'll have the digit formation. Now, As the limb continues to grow, around the 6th and 7th week, you're going to have mesenchymal consolidation of the lateral plate mesoderm that are going to form what we call digital rays. So here are our digital rays. You can see that they're starting to look like fingers, but we have some tissue in between, all right, which we call digital webs. So this is happening around the 6th and 7th week. So you're starting to see something similar to digits, but there's still tissue in between. So in order to get rid of that tissue, our body undergoes programmed cell death known as apoptosis. So again, apoptosis is programmed cell death. And this is going to really degrade all of the tissue between the digital rays, so you're getting rid of the digital webs. And this is occurring during the 8th week of development. So you can see here we have the digital rays, the notches in between, we have the webs, and the webs are eventually going to go away, and we're going to have the digits as we know and for adult anatomy. And this is again occurring around the 8th week. Now it's important to note, because remember we're in the fetal stage, all of these structures are very, very small, so we still need continued growth of the digits. So that means at the tip of each digit, we still have the AER that's going to continue to signal for elongation of those structures. Now, during development, because we're starting at the embryologic stage, the initial joints are not positioned the same way that we would expect in an adult. So the elbows, as we're growing out, are actually positioned posteriorly, or more laterally in the fetus. And we know an adult in the anatomical position, they are going to be positioned posteriorly. So at some point we have to go from a lateral position to a posterior position. Same with the knees. The knees are initially positioned laterally, but in the adult, they're going to be positioned anteriorly. So there needs to be some kind of rotation around the limbs. So this is going to happen around the 7th week, and in the upper limbs, you're going to get lateral rotation or external rotation, and this is going to happen at 90 degrees, and it's going to take the elbow from pointing laterally to pointing posteriorly, which is the same structure that we see in the adult. And for the lower limbs, it's just in the opposite direction. Instead of rotating laterally, we're going to rotate medially, also known as internal rotation, and that's going to be at 90 degrees, so that way the knees point forwards. And this gives us the structures that we know in adult anatomy, with the elbow pointing posteriorly and the knee pointing anteriorly, and again happening at the 7th week. So while we have developing of the limb bud, it's also important that we recognize that we have skeletal development that is going on as well. And what's really important to note is that the bones of the upper and lower limb are going to be forming due to a process known as endochondral ossification. And so this happens through a series of steps. Initially, we have the lateral plate mesoderm that is going to condense and form chondrocytes. So chondrocytes are going to be cells that are specifically forming cartilage. Okay, and the cartilage that they're going to be forming for these bones is known as hyaline cartilage. And this is forming the template of the bones. So here we have condensation of the mesenchyme, specifically the lateral plate mesenchymal cells, and then eventually you're going to have transition into chondrocytes, which are going to be forming the templates of the bone, which is hyaline cartilage. So you can see that here we have chondrocytes forming that cartilaginous structure that will eventually form the long bones. Now, over time, we're going to want to take that cartilage and turn it into bone, and that is a process known as ossification. So the ossification in the long bones is going to happen at the primary ossification center, and in long bones, that is at the level of the diaphysis, which is the center of the long bone. Ossification is then going to progress distally, so it's going to progress towards either end of the long bone. So it's going to progress up here, and it's going to progress down, but it always starts at the center at the diaphysis. Now, over time, after birth, you're going to start to have a secondary ossification center form, and this is at the epiphysis, or at the top of the long bone. And so that means that you're going to have ossification in this region, ossification more centrally to the bone, and you're going to have a region here that does not have ossification occurring, kind of in between the two. And this is going to be known as your epiphyseal plate. And this is what allows you to grow after you're born up until puberty. So eventually the secondary ossification center and primary ossification center are going to join, and there will be no more growth that can occur. So what I want to point out is this process in development is going to start proximally and then work its way distally. So you're initially going to have the transition to chondrocytes and then ossification happening more proximally in the upper limb at the humerus. Then it's going to happen at the radius and ulna, and eventually it'll get down into the hand. So kind of a general summary of the different steps that happen here with the timeline of fetal development. The mesenchymal consolidations which is eventually going to give rise to the chondrocytes. This is happening at the 4th week. The rise of the chondrocytes is known as chondrogenesis. This is happening in the 5th and 7th week. And remember that these cells are derived from the lateral plate mesoderm, and they are laying down cartilage, which is the template for the bone to form. Once the template is made, you're going to begin to have ossification of that template. And that ossification is going to occur starting in the 7th week at the diaphysis of the bone, which we can see here, and it's going to progress all the way until puberty, at which point there will be no more bone or no more template left to ossify, and that is going to be our adult height. And the point that I want to make is that all of the bone that is formed in the upper and lower limb is being derived from the lateral plate mesoderm. So this isn't the paraxial mesoderm, but it's specifically the lateral plate mesoderm. So I want to bring us back to when we were forming the notochord and inducing the neural tube and neural plate. Remember that the notochord causes the neural tube to form, but it also causes the paraxial mesoderm to differentiate into two different layers of somite. So the somite is the segmental region directly beside the notochord, and it's going to differentiate into the sclerotome and the dermomyotome. What we want to pay attention to for the limb development is the dermomyotome. So again, the dermomyotome is seen here in blue, and we initially talked about it as forming the axial musculature and the associated dermis, but here I want to mention that it also forms the muscular compartments of the upper and lower limb. It's not the bones, or the vessels, but the muscular compartments. So we can see that process happening here. So initially, the dermomyotome is positioned beside the notochord, but it's going to begin to migrate with the limb buds. So it's going to migrate down with the limbs. And then here we can see that it's going to set up a position that's both dorsal and ventral, so anterior and posterior, to the developing bone. And again, remember that the bone is formed by the lateral plate mesoderm, happening by chondrification followed by ossification. But the musculature, that is due to the dermomyotome migration, meaning that it is paraaxial mesoderm, not lateral plate mesoderm. Okay, and as we mentioned, these tissues are going to arrange into an anterior and posterior space based on relative position to the bone. And then eventually, so here they go anterior and posterior. Once you get rotation of the limbs, which again happens around the 7th week, where the elbow is now pointing posteriorly, the knee is pointing anteriorly, you now have your flexor compartment and extensor compartment. And this will help make sense when you're learning the anatomy of the upper and lower limb and the musculature compartments that are present. Okay, so now we've got musculature, but we also need to innervate these muscles somehow. So innervation is going to occur simultaneously with limb development, and the way this happens is we're going to have neural crest cells and different components from the neural tube sending their spinal nerves to the limbs throughout this process. And specifically, you need to know that the limbs are innervated by anterior rami. And initially, they're segmental just like everything else in the body, but over time, these are going to start to form a plexus. So you can see segmental innervation. And then eventually, as the limb starts to form, everything becomes plexiform, meaning that it's joining together and forming the nerves that we know for the adult anatomy of the upper limb. So the plexus that forms for the upper limb to provide innervation is known as the brachial plexus. And it's important with the anatomy that you understand all of the structures that give rise to the brachial plexus and all the associated nerves. The lower limb, however, is going to be the lumbosacral plexus. Okay, so these plexuses are going to provide innervation to both the upper limb and lower limb. Right, and then innervation, the growth of these to the distal limbs, is going to happen during the 5th and 7th week, and it's going to continue to remodel until you get to the adult nervous system. So similar to the innervation, we also have to vascularize these limb buds, which will eventually grow into the upper and lower limbs. So in the initial stages of development, each one of these limb buds is going to be supplied by an intersegmental artery. Okay, so intersegmental artery supplying each one of these limb buds. Eventually, as you grow, this is going to supply vascular flow, but we have to also bring that back to the heart. And the way that happens is the eventual venous structures are going to initially be called the marginal sinus. So the marginal sinus is in the periphery of each of the limb buds, and it's mostly a capillary network that's going to drain fluid back to the heart. Now, over time, these vascular branches are going to begin to converge and form their adult derivatives over time. And it's going to start proximally and work its way distally. And so that's where you get the vascular of the upper limb, which is going to be most proximal to the brachial artery, giving rise to the ulnar and radial arteries, and the ulnar artery giving rise to the common interosseous artery. The lower limb, we start more proximally with the femoral artery, which will eventually give rise to the popliteal artery, and then that will finally converge into the anterior and posterior tibial arteries. It's not super important that you are able to identify or understand the vessels that supply the upper and lower limb at this point. What's really important to understand is that you start at an intersegmental artery with a marginal sinus draining fluid back to the heart. And then eventually, over time, all of these capillaries are going to coalesce and come together, and they're going to form the adult derivatives that you'll end up seeing as you learn and move further into anatomy. Okay, and so now to get into a little bit of the clinical anatomy. So the main points I want to make for clinical anatomy are alterations in the development of the limbs. So you have amelia, which is a lack of limb formation. So A stands for without, melia is the limbs, so no limb formation. And then you got miramelia, which is alteration or partial limb formation. And both of these are due to teratogenic exposures, specifically within the critical window of development for the upper and lower limbs, which is usually around days 24 to 36. So here you can see amelia of the upper limbs versus miramelia. So partial limb formation, but not complete. The other thing I want to mention is polydactyly versus syndactyly. Polydactyly means the formation of too many digits. And the reason that this happens is because you have extra digital ray formation. So usually you should have 5 digital rays, 1 for each digit. But if you have an extra digital ray formation, that will eventually grow into an additional digit. Syndactyly, however, is due to failure of apoptosis of the digital rays, or failure of the digital webs to apoptose, meaning that the 2 digits are going to be combined. Okay, so here is inappropriate fusion of the digits, and that's the main difference between polydactyly and syndactyly. And with that, that'll bring us to an end of this video.